If you wake up every morning with a dry, sticky, parched mouth, I need you to stop blaming your bedroom air. Stop blaming your ceiling fan. Stop blaming how deeply you were sleeping. Because a dry mouth when you wake up is one of the most overlooked warning signals in the entire human body. And in people over 60, it is almost never just about hydration. It is your body trying to tell you something specific, something that most doctors never connect to that dry feeling when you open your eyes. Today, I am going to tell you exactly what it is warning you about. I have been in clinical practice for over 10 years working with older adults, and dry mouth comes up more than almost any other symptom. Because almost everyone has it, almost everyone dismisses it, and almost no one has had it properly explained to them. Today we are covering the 5 real causes of morning dry mouth in seniors, what each one actually means, what it is connected to inside your body, and exactly what to do about each one. Every fact I give you today comes from published research you can verify yourself. Cause number 3 is the one that shocks people most. Most people have no idea their medication is doing this. If you have not subscribed yet, please do that right now. 2 seconds. Thank you. Now, let us start with what saliva actually does, because once you understand that, everything else makes sense. What saliva actually does, and why losing it at night is dangerous. Most people think saliva is just spit, something your mouth makes to help you swallow food. That is the smallest part of what it does. Saliva contains antimicrobial proteins that fight bacteria every second of the day, enzymes that begin digestion, and minerals that constantly remineralize tooth enamel. While you sleep, saliva drops. That is normal. But when morning dry mouth is persistent and severe, the protective buffer is gone and bacteria fill that gap. This is why untreated dry mouth accelerates gum disease, cavities, and oral infections in older adults faster than almost any other factor. A systematic review published in Drugs and Aging found that approximately 60% of older adults report dry mouth, and that this figure is directly linked to polypharmacy, the use of multiple medications simultaneously, which is extremely common in the over 60 population. 60%. That means if you are in a room of 10 seniors, 6 of them are dealing with this, and most of them think it is normal. Cause 1. Your medications, the most common cause nobody talks about. This is the one that surprises patients most. A systematic review published in the Journal of the American Dental Association found that 80% of the most commonly prescribed medications list dry mouth as a side effect, and that more than 400 individual medications are associated with salivary gland dysfunction. Which medications specifically? Blood pressure medications, particularly diuretics and beta blockers. Antidepressants, SSRIs and tricyclics. Antihistamines taken for allergies. Bladder medications for overactive bladder. Sleep medications. Certain cholesterol medications. Parkinson's medications, and many common pain relievers. These are not rare drugs. These are the most prescribed medications in America for adults over 60. The mechanism is direct. Most of these drugs block acetylcholine, the neurotransmitter that signals salivary glands to produce saliva. Take them at bedtime when saliva is already at its lowest and you wake up with a mouth that feels like sandpaper. A cross-sectional study of 769 older adults, published on PubMed, found that 37.3% had xerostomia, the clinical term for dry mouth, with age and anticholinergic medication use as the 2 strongest independent predictors. What to do? Do not stop any medication without your doctor, but at your next visit ask specifically, could any of my medications be causing dry mouth? Ask whether any can be shifted to morning dosing. Timing alone can make a meaningful difference. And ask whether any have alternatives in the same class with fewer anticholinergic effects. Cause 2. Sleep apnea, the cause that is also quietly damaging your heart. If your dry mouth is accompanied by any of these, morning headaches, waking up feeling unrefreshed even after 8 hours of sleep, a bed partner who tells you that you snore loudly or stop breathing at night, or extreme fatigue during the day, you need to hear this section very carefully. Obstructive sleep apnea, OSA, is a condition where the airway repeatedly collapses or narrows during sleep, causing breathing to stop and restart dozens or even hundreds of times per night. Each time the airway obstructs, the body shifts to mouth breathing to compensate. Mouth breathing bypasses the nasal passages entirely and dries the oral mucosa rapidly. A study published in the Journal of Clinical and Experimental Dentistry, PMID 16,911,034, examined 1,000 adults with dry mouth upon waking and found that 31.4% had obstructive sleep apnea. Those with more severe apnea had significantly worse dry mouth symptoms. The SAHS group in the study showed 45% experiencing dry mouth upon awakening, compared to only 20.4% in the control group without sleep disorders. Undiagnosed sleep apnea is a leading modifiable risk factor for high blood pressure, atrial fibrillation, stroke, and cardiovascular disease in adults over 60. Every time breathing stops, oxygen drops, and the heart responds with a surge of stress hormones, repeated hundreds of times per night, accumulating silently over years. What to do? Ask your doctor about a home sleep test, done in your own bed, no clinic required. If sleep apnea is diagnosed, CPAP therapy is highly effective. Most patients notice dramatic improvements in morning dry mouth, energy, blood pressure, and cognitive clarity within weeks. Cause 3. Elevated blood sugar, the warning sign hidden in your mouth every morning. This is the connection almost nobody makes, and it may be the most clinically important one on this list. Dry mouth is one of the earliest symptoms of undiagnosed or poorly controlled blood sugar. The mechanism runs 3 ways at once. High glucose pulls water from tissues, including the salivary glands, through osmotic pressure. Chronic high glucose damages the autonomic nerves that signal those glands to produce saliva. And elevated blood sugar forces excess urine output, flushing fluids out through the kidneys and leaving the body in a persistent, mild state of dehydration. A systematic review by Lopez Pintor found dry mouth prevalence in people with diabetes ranging from 12.5 to 53.5%, versus 0 to 30% in non-diabetic groups. A cross-sectional study in PMC found that elderly adults with diabetes had an odds ratio of 3.59 for dry mouth, nearly 3.6 times more likely than non-diabetic peers. What to do? If you have persistent morning dry mouth and have not had your HbA1c checked in the last 12 months, call your doctor this week. The test takes 10 minutes at any lab. If your result is between 5.7 and 6.4%, the pre-diabetic range, that is the window where targeted lifestyle changes can reverse course. Catching this through a dry mouth symptom before other complications develop is exactly the kind of early intervention that changes outcomes. Cause 4. Chronic mild dehydration. Not what you think. In older adults, dehydration is almost never acute. It is chronic, low-grade, and invisible. The thirst mechanism weakens after 60. Younger adults feel thirsty at 1 to 2% dehydration. Seniors may not feel thirst until 3 to 4%, by which point cognitive and kidney function are already measurably impaired. Add to this, many older adults deliberately restrict fluids in the evening to avoid nighttime bathroom trips, which means they go to bed already mildly dehydrated, sleep for 8 hours during which the body continues to lose water through respiration and perspiration, and wake up with the cumulative deficit fully expressed in the mouth. What to do? Drink most of your daily water before 6 p.m. A 10-ounce glass first thing in the morning, before coffee, is the single most effective daily habit for dry mouth from dehydration. Add half a lemon. Citrate stimulates saliva production directly. A cool mist humidifier at 40 to 50% humidity helps significantly in winter when forced air heating strips bedroom air of moisture. Cause 5. Mouth breathing during sleep, and why it happens more after 60. In a controlled study, upper airway moisture dropped from normal levels to nearly 0 after 2 hours of oral breathing, while nasal breathing over the same period actually increased oral moisture. If your mouth falls open during sleep, even partially, that is enough to cause the dry, cracked feeling you wake up with. After 60, this becomes more common as nasal passages change structurally, allergy congestion worsens, throat muscle tone decreases, and sleep apnea prevalence rises. What to do? The Neilmed Sinus Rinse at Walmart, Target, and CVS, used before bed, clears nasal passages and promotes nasal breathing during sleep. Breathe Right nasal strips at any pharmacy physically dilate the nostrils and are genuinely effective for mild mouth breathing. For year-round congestion that does not respond, ask about an ENT referral to rule out a deviated septum, far more common and far more correctable than most people realize. The morning protocol and when to act today. Morning dry mouth is not a nuisance. It is a message about your medications, your airway, your blood sugar, your hydration, or your nasal passages. Here is what to do. Start tonight. 10 ounces of water, a nasal strip if you suspect mouth breathing, a cool mist humidifier if you do not have one. Tomorrow morning, lemon water before coffee. This week, if this has been going on for months, call your doctor. Ask about your HbA1c, your medication list, and whether a home sleep study is appropriate. I had a patient, Carol, 70, a retired school teacher from Memphis, Tennessee. 2 years of severe morning dry mouth. She mentioned it as an afterthought at a routine visit. We reviewed her medication list, a blood pressure drug, a bladder medication, and an antihistamine, all taken at bedtime. 3 anticholinergic drugs simultaneously, right at the hours when saliva is already lowest. We shifted 2 medications to morning dosing. Her dry mouth resolved in 2 weeks. She told me, "I cannot believe I accepted that for 2 years. I thought it was just part of getting older." It is not part of getting older. It is a signal, and now you know how to read it. Drop this in the comments. How long have you been waking up with dry mouth? I read every single one. Share this with someone over 60 who starts every morning reaching for water before they can even speak. It may be the most useful thing you share this week. This is Dr. Daniel Harres. Listen to your body. It has been talking to you. Today you finally heard it.